Hello, my name is Brittany Stewart, and I'm a family nurse practitioner and also a member of the new Beta Omega chapter of Alpha Kappa Alpha Sorority Incorporated. So, once again, I'm coming to you this month of October during Breast Cancer Awareness Month to discuss today about self breast exams. So, as a family nurse practitioner, I often teach my patients about the importance of not only getting a mammogram, but also the importance of knowing how your breasts are doing monthly. So self breast exams come with a little controversy. So there has been discussion regarding women not performing self breast exams because they think the benefit of the self breast exam is outweighed by the risk, being that some women may have increased anxiety or may overdiagnose issues. The U.S. Preventative Service Task Force, which is the person who makes recommendations and guidelines, they have kind of done away with recommendations regarding self breast exams. As a family nurse practitioner, I do recommend that all of my patients still continue to do self breast exams if they are willing. Some women don't want to, so I have to respect that. But if they're willing, I do recommend all women to continue self breast exams. So the goal of this video is going to be really to teach you how to do a self breast exam. You're not going to be perfect. You're not going to be, remarkable at it, but just to make you aware of what you should be doing. So that way, if you do feel any abnormalities, that you get to your doctor sooner than later. So, basic self breast exam basically is, like I said, self breast exam. So we would like for you to do that once a month. Some of my patients, they do it every 3 months, some of them every 6 months, but you have to know how your breast feels so you can know if there's something that's changing. So once a month, we recommend that you do it the same time every month as well. We also recommend that you don't do it during your period or like a week or so, probably like a week before or after the period. And the reason for this is because sometimes the breast tissue naturally changes because of hormones. So if you check your breast during the period, directly after the period, or even close leading up to when the period starts, you may start to notice some changes within the breast tissue that are really just related to hormones. And then after the period goes away, those tissue changes will go away on their own as well. So sometimes I do have ladies that will feel little knots or things in their breast during their period, and I have to reassure them that, okay, the period's on, let's have you come back in a week or so and recheck again so that I can see if there's anything different. So once again, once a month, same time every month. So if you're not having periods, that doesn't mean you don't need to self breast exam. So if you had a hysterectomy or if you are in menopause, I usually just recommend those ladies to go ahead and check their breasts around that same time. Now, if you have had a hysterectomy and that you have your ovaries still intact, sometimes that still can produce some hormone changes. So you may want to be careful around those times when you used to have your period, not to do your not mammogram, your self breast exam during that time. So same time every month, always checking it in a certain consistency and pattern as well. So I tell some women, if you have larger boobs or are more endowed in the chest area, you may have to do your self breast exam laying down flat. So that way the tissue can kind of dissipate, or not dissipate, but kind of evenly spread. If you have a reasonable size chest and you're able just to lift your hand over your head, then you can do your breast exam in the shower. So the location is really going to be what's conducive to you and your breasts. Sometimes gravity helps, so that's why laying down flat is better. For some women, they can do it in the shower. They're able to feel their breasts fine and normal in the shower. So those are kind of the basics for a self breast exam. Now, when you're doing a self breast exam, you're going to want to make sure that the skin is taut. So when the skin is taut, that's why we're saying that hand above the head. So you want to make sure your hand's above your head either in the shower or when you're laying down flat in your bed. So your hand wants to be above your head. That way all the breast tissue is lifted. If you have your hand down flat beside your side, the breast tissue is kind of just hanging. It doesn't get taut. So when you go to feel, you're not able to really feel that well. Another thing you want to make sure you're doing when you do your breast exam is you want to make sure that you are not using the tips of your fingers. So I have a breast model here, not actual person, but a little demo. So this demo has a pretty nice perky breasts. Some women's are going to be more flatter. Some women's are going to be more fuller, hanging, all the things. All of us ladies come in different shapes and sizes when it comes to breasts. So on this breast model, as you can see, the breast is kind of perkier. So when I teach my patients how to do a breast exam, I always want them to know you don't want to do this. This isn't good. Because if you do like this with your fingers, at the tip of your fingers, you really don't have that much sensation. You have, not sensation, I have to say, but you don't have much, the nerves aren't that endowed in that area. So you can feel a little bit with the tip of your finger, but if you slide your hand just to this area, if you feel with the flat pad of your finger, you really can feel a lot more. So when I usually watch my patients do their breast exams, they usually do this, and I say, no, 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 not going to work. You have to kind of get on the flat pad. So you have to be flat against the breast, and you have to decide how you're going to do your exam. So for this model, there are different examples of how you can do your exam. I usually tell people pick one. The most common one that I teach my patients that are easier for them to understand is going to be circular. Circular motion, this helps you to cover all the areas and helps you to remember that you didn't forget anything. And then you can go from there. So this is the left breast. So this would be like the armpit area here, and then you have the breast here. So in this diagram, you see the person has their hand above their head, which you want to do. And I always tell them, so I'm going to put this down for a second. I always tell women when you have your hand above your head, you want to go ahead and you want to start with in your arm area. So excuse my finger. I'm going to actually switch to this hand. So you want to start in your arm area. So you want to go ahead and start here, working your way down on the pad, because you want to be able to feel if there's any knots in your arm leading down. You want to also get into the armpit area. So after the shower is perfect timing because you're fresh and clean. So you want to get in your armpit area. You want to feel all that tissue in there to feel if you have any knots or lumps, because sometimes, unfortunately, with breast cancer, sometimes there's nodes, lymph nodes, that can become enlarged in the armpit area. And that can also be in the breast area, and then that's when we know things have spread. So I always tell people, check your armpit area, check your arm as well, because sometimes you may feel something abnormal there. Check the armpit, then work into your breast. So in the armpit area, you don't have to necessarily go in a circular motion, but you want to make sure that you're feeling around in that area to make sure there's no lumps or bumps. When you get to the breast, I always tell people to start in the farthest corner. So just start here. And I always tell people just go in a circle. So you're just gonna not wax on, wax off, but just circle like you're cleaning glass. So just start with that pad of your fingers and work your way around until you get around the entire breast. So if you have a larger chest, you may have to lift the breast up in order to do this, and that's okay. So just lift your breast and make sure you go all the way around, all the way around, all the way around, in a circular manner, like a spiral manner. When you get near the nipple, you also want to feel near your nipple. And some people think this is kind of weird. I have patients like, oh no, I'm not touching that. You need to touch everywhere. So when you get near the nipple, you just make sure that you're going all the way around the nipple and getting as close to it as possible. And then I'll also tell people go ahead and pinch and just make sure you don't get nothing out. Now, if you're a breastfeeding mom, you're going to get milk out. That's normal. But if you're, not to be offensive, but if you're a 50-year-old and you're pinching and you're getting milk out, that's not good. That means something's going on in that breast that you need to go get checked out. So I have had women who have had, unfortunately, who've had breast cancer that have nipple discharge. And that was one of the first signs that something was going on. And they came in and was like, hey, I got something leaking out my breast. And I said, okay, let's go get a mammogram. And we found out it was breast cancer. So if you're an older female and you have this going on, that's not good. I also want to say is if you are a male who has a strong family history of breast cancer, not necessarily breast cancer in women, but if I have had some of my male patients who had a father or a close uncle that had breast cancer in a male, and I also taught them to do self-breast exams. So self-breast exams are important for women, but they are important for men as well if they have high risk factors. So if you have a history of breast cancer in a male, you might want to do breast exams as well for a male. Now, people always ask me about implants. So, what if I have an implant? What if I have an implant? Well, a lot of implants are made under the breast tissue, so they're made underneath the muscle. So, you still have viable breast tissue out here that you still need to be checking. Some women have had implants put above the breast muscle, so the implant is actually in like the breast tissue. For those females, I tell them you still need to check your breasts. It's going to be a little harder because you have an implant in there that can kind of obstruct things. But you do need to get a mammogram. So some people that have implants think that they don't need to get a mammogram, or they do not want a mammogram because they don't want anything to be ruptured, is what I usually hear. So that's a discussion. If you have an implant and it's above the breast tissue, you might want to discuss with your provider. But mammograms are still going to be important for you because you still have breast tissue that can get cancer. So with the breast exam, just find a pattern that works. Use that same pattern all the time, and just make sure you use the same technique. So if you're doing circles, always do circles. If you are doing zigzags, zigzags is like you do a row and then you go up the next row. This one is a little bit harder for people that aren't used to doing not mammograms, but self breast exams to do. So a lot of people, they don't do this one. I always, like I say, the easiest one for me to teach people to cover all the bases is circles and going in spirals all the way around the breast. Make sure you don't exclude the nipple because the nipple is important, and make sure that you are being consistent. So at the beginning, especially till you know how your breasts feel, make sure you're checking once a month because your breasts can have different changes in there that are natural. So when you feel it and you felt it a couple times, then you know, oh, that's normal. But sometimes there can be things in there that aren't natural for you, and you need to be able to know immediately where to go to get taken care of. The other thing that you want to do with a self breast exam is mark it on your calendar. So I tell people so they won't forget. The same way a lot of women mark their periods if they're very good with it. Some people don't. Hey, I'm not gonna lie, I ain't one of them. But mark your calendar to say when you did your self breast exam, so that way you know when you did it. The same way you need to make sure you're away from your period because you will notice changes. And then just make sure that if you do notice something, say something. So I've had patients that have called me and been like, Brittany, I did my self breast exam and I felt something in my breast. And I tell them, come on in, taking them an appointment. And sometimes I feel them like, oh, this is nothing, or fine. And sometimes I feel myself, oh, I'm kind of concerned. Let's go ahead and move the next step, which is like a mammogram or ultrasound, depending. So definitely say something. Don't just be like waiting 6 months until your next appointment and be like, oh, well, I felt 6 months ago something in my breast. Say something. It's better to be safe than sorry. Even if your provider says, oh, it's nothing, still say something so that way you can be rest assured that if you feel it the next month, you know that this isn't anything that's that serious. So once again, this breast, like I said, it's the left breast. This is like the armpit area, just in closing. So you want to just make sure that you start in your arm. You want to make sure that you're kind of checking around, making sure you don't feel anything abnormal in there, in your armpit as well, because if you feel something in your armpit but don't feel it in your breast, you still need to tell somebody about that too. So you want to check in your armpit, and then when you get towards your breast, you just want to make sure that you get a good starting point and that you work your way around. Like I said, I'm going to say circles, and you use the flat pad of your finger. So you just make sure you use that finger flat pad and you work your way all the way around your breast. You may have to shift some things up or down, depending, to make sure that you're able to cover all your breasts, and that's okay. But you just want to make sure that you're using the opposite hand. I didn't mention that. So if your hand's above your head, you have to use the opposite hand to do your breast exam. But I want to make sure I mention that. Don't put your hand down and then try to use your same hand. That's not how it works. So just make sure you're going in circles. When you get down to the center near your nipple, make sure you're checking around the nipple and that you squeeze under the nipple. So you want to squeeze under enough to make sure if anything comes out, it's going to come out. Don't force anything out, but you want to make sure you're squeezing enough to make sure if something's going to come out, it has enough momentum to do that. And if you notice anything, say something. So I'm going to put this boob down now. But so that is the conclusion of that self breast exam. It's very invigorating once you learn how to do it, to know how your body feels. I think everybody should know how their body is. So that way you are your best advocate. If you know what your body is supposed to do and not supposed to do, or how it's supposed to feel and not supposed to feel, you are able to be fine tuned to know when something is happening, so you can go ahead and speak up. And if you find that you're in a situation where you're expressing your concerns and it seems like it's not going anywhere with your provider, then it's time to change, and that's okay. You are your own best advocate, and if somebody's not doing what you need them to do as you're advocating for yourself, then it's time to move on to the next provider. There's a lot of providers out there. You're not stuck with just one. So just make sure that you're continuing to look into taking care of yourself all year long, not just during Breast Cancer Awareness Month. Self breast exams is a definite easy way to start. It's something that you can do. It's cheap, it's free, and it doesn't require a lot of mindset or mind work to do it. You just not even do it without thinking. But just make sure you take care of yourself, ladies and gentlemen. And we will see you in the next Breast Cancer Awareness Month, which is next October. But if there's anything that's new and exciting coming out health wise, we'll be sure to bring that to you. So, once again, my name is Brittany. I'm one of the members of the new Beta Omega chapter of Alpha Kappa Alpha Sorority Incorporated. And I'm wishing you a happy and successful year. And thank you for tuning in today. Have a good day.